There are many questions patients have about how we do adjustments and what the instrument is actually doing. Do bones get misaligned, or do they just lose their range of motion? In this video, I'll give you some exact details on a plastic model spine, exactly what happens during a chiropractic adjustment. Hope you learn.
These here are the bones of the actual spine. And one of the procedures that we use when we analyze a person's spine is I'll very often take my thumb or finger and I will just simply push on each individual vertebrae, just like so. And what I'm looking for is how flexible of movement I feel underneath my thumbs. So I drew a picture here in between these two bones, and you can see that there is pink. This shows you where the joint movement happens. You can see the bones can move and separate. That is a normal situation. When we say that bones get misaligned, what we actually mean is not that the bone misplaced itself, but rather there's a lack of movement where these two bones meet. So when the person tries to bend and rotate, the spine works as a unit. You could see in that area where there's the pink between the two bones, there's actually no separated movement between the two bones. They move as a unit. This is abnormal. We call this a misalignment, but in truth it's simply a lack of movement between the bones. There are a number of reasons this can occur. There can be tightness of the ligaments that connect the two bones together. There can be muscle spasm in between the bones, but more often than not there is a cartilage damage between the two bones, and that is the reason why there is a lack of movement. Now what a chiropractic adjustment does is to restore the movement at that segment. So what ends up happening, you can see in between the two individual bones where the pink is, now there would be motion. That is considered normal. There are many ways to adjust the spine. Some are more forceful than others. I've been using for the last many years an instrument called an arthrostim, and simply I would place it right where the vertebra is, and I would be using a force. Now, when you use this, it causes a vibrational force onto the spine. When this occurs, it actually frees up the joint in this area so that it can move normally.